We begin tonight in Hamilton, where the Children's Aid Society is set to cut up to 19 staff members in a move an executive says is due to budget cuts, a decrease in demand, and overwhelmed community support systems.
Yeah, meanwhile, there are concerns these layoffs at the Hamilton CAS will lead to staff burnout and put kids at risk. While it's the most recognizable agency for kids in crisis, the Children's Aid Society has a specific role.
Our work is working with at-risk families and assessing abuse and neglect and challenges that families are facing related to those issues.
Executive Director Brian Schoen says after the height of the pandemic, reports of child abuse and neglect actually decreased. Instead, the agency has been taking on other issues, particularly mental health concerns among children, that are not within its scope.
Social services in our community are still reopening, especially mental health and developmental services. And that has caused our costs for children and youth that we're serving in care to actually increase quite substantially as well.
A demand that Schoen says will be tough to meet, seeing that they're looking at steep financial cuts down the road.
Receiving 2% less in terms of our budget over the next 2 years. To the tune of about $2 million.
19 frontline, executive, union, and non-union jobs are set to be eliminated in the near future. Schoen says those affected haven't been notified, but in the end, he says there won't be cuts to services. He adds, however, that if other community services, such as mental health clinics and affordable housing, continue to be scarce, Children's Aid workers' jobs won't get any easier.
That creates significant burnout for staff. You can imagine if you're making 25 phone calls to get one service, or you're working with a family over 3 or 4 months to try and just secure housing. Those are some of the realities for our staff.
According to Children's Mental Health Ontario, 36% of parents have sought help for a child dealing with mental health issues. 40% of those say they didn't get help or are still waiting. Well, staying with Children's Mental Health Ontario, Ontario's per capita spending in health care was found to be $1,361 versus just $16.45 per capita for mental health.